Good day, everybody. My name is Dr. David Amron. Welcome to Lippy Logic at the Lippy Lounge. Today's topic is going to be recovery. Every surgeon has their own particular recovery protocol. And I don't think I've ever seen two protocols that are exactly alike with different surgeons. And it's the one area that I've spent a lot of time refining my own protocol for lipedema patients specifically in terms of recovery. Continually trying to make little improvements and adjustments to it. The best way I can probably do this is go through a timeline in terms of what goes on with the recovery immediately when surgery ends all the way up until a year later. So let me see if I can run through this. I explain this to many patients over and over again. So let's get all the different points of recovery up until a year. So when the patient is finished with surgery, and I think you know this from my approach, I avoid general anesthesia in almost all patients. It's either done under twilight or patients under local anesthesia. So the patient is fairly conscious when the surgery is done. Many times we'll sit them up to look at their new legs after the surgery. And then I leave the room and leave them in the care of the surgical team and the nurses to take care of things. So what goes on is almost never a patient is in pain at the end of surgery with things like that. But the patient is what I call milked on the table, on the operating table, to remove a lot of the fluid. Remember, this is tumescent anesthesia. A lot of fluid is used as part of my process and protocol. And that fluid mostly drains on the table, and we continue to milk that fluid out. The patient is then taken to the recovery room where they're monitored for about an hour, many times given fluids, and they're put into a compression garment. They're either in the recovery room itself or in the operating room. I then come in and go through all the instructions of the patient and let them know everything went beautifully and this and that and what I found and how much fat was removed, all those things. And typically the family will be part of that also. The patient goes home the evening of surgery in the care of a friend or family member that typically comes with them, or if not, we'll arrange somebody for the patient. They cannot be by themselves the evening of surgery. If they're very complicated, advanced patients with complicated medical conditions, I may want them going to an aftercare facility for monitoring with things, but that's rare and unusual. The evening of surgery, they'll typically continue oozing and draining. That goes on for typically 24 to 36 hours, where there's that pinkish watery solution that comes out. There's pads over the garment that absorbs that fluid. When I call the patient that evening, they're typically rarely in really a lot of discomfort. I would tell you that probably 10% of patients or less are really in quite a bit of discomfort. Most people say, really, it was not so bad, much easier than I thought. They're a little bit sore with things. Patients have pain medications that they can take, but I try to encourage them to only take it if you really need to, because your body's clearing a lot of medications the evening of surgery. It's clearing the anesthesia, it's clearing the lidocaine that I'm using in the solution, and that will tend to peak about 8 to 12 hours later. And when they go home, if they start just popping pain medications, it's competing with a lot of things. So I try to encourage them to not take it unless they really need to. Most patients will just take Tylenol. They eat and drink normally the day of surgery. I want them to just generally relax that evening of surgery. They can walk around a little bit, but they're not going to begin their walks that day of surgery. They definitely need to be with somebody the next 24 hours. So that includes the middle of the night to go to the bathroom. One of the most important things I tell patients is you cannot walk yourself. You have to wake up whoever that is, your husband, your friend, who's ever with you. You've got to give them a little jab on the side and say, I've got to go to the bathroom. They have to chaperone you there and then take you back to bed, because you are prone to feeling a little bit lightheaded the day of surgery. There's a lot of fluid shifts that go on. We call this orthostatic, where your pressure can drop a little bit when you're standing up, and even more so with lipedema patients. So it's important to have somebody with you while you're moving around that day of surgery into the next day. You will continue your antibiotics twice a day till they're gone. And then the next morning you come back to my clinic for the postoperative check. Well, I will see you, evaluate things, not really about results, because it's too early to really be looking at results a day after the surgery. Make sure everything's healing properly with things. You will then begin your MLD therapy the day after the surgery with my MLD therapist at the clinic itself. Typically you will do that the day after the surgery and then 2 days later after that. And then you're ready to fly back home, and we'll talk about that. You will begin your Lovenox injection. So part of my protocol is that for 5 days after every surgery with lipedema patients, because of the increased risk of clot formation, I began this many years ago, every patient's on Lovenox after the surgery. If patients have other hypercoagulable states, I may have coordinated care with their hematologist or their doctor back home where they are. More advanced patients, this is an important thing. So most patients decongest in what I call a linear fashion, where their swelling just goes down, 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 down. Some patients become more congested in the short term. They're what I call the slow decongestors, and they'll go into more of a state of tense congestion. And it's still very difficult to pick which patient may do that. Generally, the patients with more fibrosis, the more advanced patients, are going to be more at risk of that. Certainly patients with lipolymphedema. But sometimes I've been surprised. An uncomplicated stage 1 patient will have it, and a stage 3 or 4 patient won't become a slow decongester. But slow decongester patients, they may get bandaged and wrapped before they go back home, either the day after surgery or 2 days after that, before they get on the plane flight to go back home. I almost always want walks beginning the day after surgery, that patients gradually increase each day, and it depends how a person's feeling. It's not like a competition, like let's go do 2 miles in 18 minutes or something, but just to begin your walks the day after the surgery. The walking does help to move fluid along. And find that sweet spot for yourself. Gradually increase that each day. In the plane ride, if you fly in on the way home, you've got your compression garments on, but I want you getting up every couple hours and walking around for a few minutes. One thing I forgot to mention is that the showering. So you don't shower until the day after your procedure. So after the postoperative visit with me and your MLD therapy, you then can go back home and shower. But I almost always want patients showering in the garment for 4 days after the surgery, because there's a lot of fluid shifts that go on. If you take the garment off and then jump in a shower, you will vasodilate in the shower and increase your chance of feeling lightheaded. So keeping the garment on the first few days until your body begins to re-equilibrate is very, very important with regard to that. But generally, after 4 or 5 days, the garment can be taken off to shower outside of the garments. When you get home, you should be able to resume most routine activities, including work around the house and even going to work for most patients, but you've got the compression garments on, so you have to wear looser clothing on top of that. Lighter exercise the first 3 weeks after the surgery until any bruising that occurred has gone away, and then you can generally, in most patients, resume more of a routine exercise plan. Wearing of the garments, I want you wearing it 24 hours a day for a month, and then we will check in with you, and if you're like most patients in decongesting in a linear fashion, you can reduce that to 12 hours a day after that first month. Any 12 hours is fine. If you're a more congested patient, then no, we're going to want you to wear that garment longer, possibly 24 hours a day for a longer period of time. We're going to institute other compression protocols such as compression pump therapy, possibly bandaging and wrapping will go on, vibrational plate therapy. These are things that it's important to be continued by your pre-identified lymphatic therapist back home again. So prior to your surgery, we're going to identify with you that lymphatic therapist that we have our trust in to continue to care for your lymphatic therapy. Most patients begin to see an improvement in the first month. Sometimes it's dramatic, a month after the surgery, and sometimes it's like mind-boggling how much improvement there is in areas like calves and ankles. Other areas take longer to improve. Generally, there's more laxity of skin and tissue, there's more fluid. That's going to take time to start to contract down, and you may not see as much improvement in the first month with things. And it will then be a slow process, especially if I'm using certain tightening devices like J-plasma that's causing contraction of the tissue. That's going to take longer to get your final result with things. Your final result, generally, I will say, is truly more like 12 to 18 months. Yes, after 6 months, you've had most of your result, but it continues to improve after that. And then if you're like most patients, this added bonus goes on, that you will tend to then lose weight in other areas. And I've talked about this in other segments because you're removing all that hormonally active lipedema fat that is slowing your metabolism down. And then even if you don't change your diet and exercise, you begin then to lose weight in other areas. I can't tell you how many patients I've done, especially the larger patients, stage 3 patients or so, that you do their 2 surgeries with lipedema. You remove all that lipedema fat, all the liters of fat. You've decongested things properly. That fat is not only responding to hormones, it begins to produce estrogen and slows your metabolism down, and people find themselves starving and can't lose weight. And all of a sudden, miraculously, after the surgeries for lipedema, despite those areas getting hugely improved, you now begin to lose weight in other areas that goes along with it too. That's recovery, a lot of information. Hopefully that gives you a really great idea of the whole process from immediately after surgery to a year and a half later. My name is Dr. David Amron. This is Lippy Logic at the Lippy Lounge. Thank you for tuning in and continue to learn about things and get involved with lipedema.